Bismillahirrahmanirrahim. Assalamu alaikum. This is FAHMIDA CHANNA, lecturer Zoology from Government Girls Degree College Moro. Dear students, today we will discuss about some viral diseases. Contents of today's lecture: rabies, flu, cold, polio, hepatitis. Now let's start today's lecture from rabies. Rabies is known as hydrophobia also. It is a viral disease of human beings and other mammals also. The virus attack on the nervous system. Cause and transmission. Rabies is caused by this rubedovirus, and the transmit through this rubedovirus is through mammals and like dogs, bats, and foxes. Rubedovirus can enter the body by means of bite of infected animal, and they affect on the nervous system. They become cause a condition that is known as hydrophobia. The patients suffer from or hated from water due to this rabies. Now poliomyelitis. Poliomyelitis is often known as polio and also known as infantile paralysis. Why is known as infantile paralysis? Because it most watch or observe in infants, therefore is known as infantile. Why is known as paralysis? Because the paralysis takes place in children, therefore is known as infantile paralysis. It is an infectious virus disease that sometimes result in the paralysis. Poliomyelitis mostly affects children or young ones. Cause and transmission of polio. Poliovirus is RNA virus. Poliovirus is caused by the three related virus known as poliovirus. Transmission is mainly by orofacial route and slightly through respiratory route. Now let's start flu. Flu is infection of the respiratory tract. Flu caused by flu virus and transmitted by one person to another person through the coughing drops and sneezing into the air. It means it is an aerosol transmit. It means those diseases which transmit through the air, that is known as aerosol transmitter. Clinical features: there are features like a cold like, and some of them are fever, headache, pulse, chills, fatigue, and muscle ache. Common cold. Acute infectious disease of upper respiratory tract. Cause of common cold is more than 200 kinds of enveloped plus strain RNA virus is a cause of common cold, and 1/3 caused by rhinovirus. Clinical feature of common cold are: the infection affect the mucous membrane of nose and throat, therefore discharging from the nose, sore throat, it means itching in throat, coughing. These are the symptoms of cold. Hepatitis is a comprised of two words. Hepa means liver, titis means inflammation. It means inflammation of liver is known as hepatitis. Its etiology: it means cause of hepatitis are small genome DNA virus. Some toxic agents or drugs are the cause or etiology of hepatitis. Clinical features means symptoms of hepatitis are jaundice, abdominal pain, liver enlargement. It means hepatomegaly. Hepato means liver, megaly means enlargement, loss of appetite, fatigue. In some cases patients have a fever also. Types of hepatitis: hepatitis A. Hepatitis A is showing HAV. It's short form of hepatitis A. Live in a feces in the intestinal tract. It is spread when drinking water is contaminated with raw sewage or contact with feces from an infected individual. Vaccine is developed or available in the market. Hepatitis B. This virus is a hepatitis B virus, showing this figure. Hepatitis B is formerly known as serum hepatitis. Why? Because it transmitted through the blood transfusion, therefore is known as serum hepatitis. It is caused by usually DNA virus that is shown this figure. Often carries without causing any symptoms. It is rapidly transmitted by skin contact, blood transfusion. Similarly, medical procedures is the most common among Asians, Africans, and Due to the homosexuals, vaccine is available in the market. Hepatitis C. This figure shows the hepatitis C virus, that is RNA virus. It passed through blood transfusion, mother to pregnancy. It means through placenta during pregnancy, transfer to the new young one through the milk feeding of mother, and sexual contact is transfer. Hepatitis C virus. Signs and symptoms of hepatitis C are rarely acute symptoms, mostly asymptomatic until liver failure. It means no symptoms till the liver is not fell down. There are no symptoms. 50% of those infected progress. Still, vaccine is not developed, but treatment is a possible of hepatitis C. Now, acquired immunodeficiency syndrome. It means AIDS. AIDS full form is acquired. I stand for immuno, D for deficiency, S for syndrome. It is caused by HIV virus, retrovirus. The AIDS was reported by some physician in early 1980 in a young male. Human viral disease that damaged the immune system of the body ability to defend itself from infection and a disease. Cause of AIDS. AIDS caused by human immunodeficiency virus, and that virus is attack on, that is a virus, HIV virus, and that is attack on the T lymphocyte cells, and these are the type of white blood cells that are showing in this figure. This virus, that is HIV virus, and that affect on this T cells, and the immune system is a depressed. You can get HIV through, it means they are the transmission of HIV, unprotected sex. 90% of HIV transmitted through the sexual contact, sharing drugs, injections, needles, childbirth, blood, amniotic fluid, vaginal fluid, breastfeeding, contaminated blood, and blood products. These all are the vectors. It means they are transmit the AIDS or HIV virus. Signs and symptoms of HIV are AIDS patient. Current information suggests that 1 to 2% of HIV infected person will develop AIDS each year, and 5 to 10% of HIV infected person will develop AIDS related symptoms each year. Here some symptoms showing through the figure. Also, rare type of pneumonia found in the patients affect the lungs. Rare type of skin cancer called copsisarcoma. Here this structure showing the copsisarcoma. Weight loss, dementia means memory loss. Diarrhea, it means effect on the intestine, showing this figure. Insomnia, it means lack of sleep. These all are the signs or symptoms or clinical feature of AIDS patient or HIV positive patient. This also showing the symptoms of HIV infection. HIV not transmit through the following way, like a sharing food, insect any bite, sweating, sneeze and coughing, through which HIV is not transmit. Treatment and prevention of HIV or AIDS are developing drugs to cure disease such as AZT, Sumarin, Ribavirin. Developing a vaccine is still not succeeded. Best known drugs used in 1987 were azidothymidine or zidovinermin, formerly known as AZT, which slow progressive of disease. Ribavirin drug used to treat viral infection, which has been found to suppress the AIDS virus. Thanks to all. Any comments, any suggestion, please give me.